Well, good morning. I'm proud to be here with the announcement today, which I'll mention in a minute. We've got Mayor Curry. I want to thank him. Do we have the representatives? Who do we have? Okay. So we have Wyman Duggan, Sam Garrison, Jason Fisher, and Cord Bird. I have Kevin Guthrie, Director of the Florida Division of Emergency Management. And then we have Dr. Ken Shepke. He's the Chief Medical Officer for the Florida Division of Emergency Management. One of the things that we're seeing, you go back a couple months, obviously there'd been a big vaccination drive in Florida. We've done almost 4 million senior citizens, really focused on the seniors and the at-risk population. You saw that throughout the country. There was the hope, we fully expected that to provide protection against severe illness, but there was also the hope that potentially would create an effective shield of immunity to make it so that infection waves were not going to be as significant as we had seen in the past. I think on the former, if you talk to any of the hospitals throughout the state of Florida, I think they will tell you that the overwhelming majority of the people that they are admitting into their hospitals for COVID are people that had not been vaccinated, that the vaccinated population is less likely to be admitted into the hospital if they get infected, and we are seeing breakthrough infections. And so from that perspective, preventing severe clinical outcomes, we've seen a lot of protection for a lot of vulnerable people, and that has made a big difference. Now, what you haven't seen is widespread vaccination limiting waves. It's not just in Florida or the whole South, it's all across the world. You look at Israel, they're one of the most vaccinated countries on planet Earth, and they're having their biggest wave of infections that they've had throughout the whole pandemic. Obviously, Florida, other Sunbelt states, but even like Hawaii, very vaccinated. We're the most vaccinated state in the Southeast, and we've got over 85% of seniors fully vaccinated. But yet you see with this Delta variant, more contagious, very easy to transmit, and it comes really in waves. And so as we're looking at that and say, okay, vaccination is clearly helping reduce serious illness. It's reducing your likelihood of being hospitalized, but you also have people who are being hospitalized. So what tools do you have that makes the most sense? And one of the things we've been talking about recently is doing monoclonal antibody treatments such as Regeneron. We've done that in different hospital systems have done it. They're doing it here in Northeast Florida. But it was something that the more we talked about it, the more people had questions. A lot of people had not even heard of it. And so we see an effort to be able to supplement that effort here in Northeast Florida and other parts of the state. We'll have additional announcements very soon, partially to be able to get more people in. And we're going to bring in a lot more Regeneron into Florida, which I think is important, but also just to raise awareness that this is the most effective treatment that we've yet encountered for people who are actually infected with COVID-19. And the way it works, the core group of people that benefit from this are folks that are at the most high risk for severe illness from COVID-19. So elderly people that have certain comorbidities, kidney problems, diabetes, morbid obesity, immunocompromised. This, if applied early and properly, has the ability to reduce your likelihood of being hospitalized by 70% in clinical trials. And I think if you talk to people that have had it in Florida, most people will say that if you do it early, it really does help to resolve the symptoms. And so what we're going to be doing here today is deploying a rapid response unit. This will starting at noon. We'll be able to deliver Regeneron monoclonal antibody treatments to folks. The key to this is if you're in one of those high-risk categories and you become COVID positive, doing it before the symptoms get very severe is when it's most likely to work. And so part of it is some people don't even know that this exists until they end up getting admitted to the hospital. And at that point, it's almost always too late for this to be effective. But part of it is just kind of a natural human instinct. Maybe you feel some symptoms, test positive, but you don't feel that bad, so you figure, hey, I'm going to clear this. If you're high risk, though, and it progresses, then you've missed your opportunity to have this be really effective. So that early treatment is really what the Regeneron and the monoclonal antibodies represent. So that's really what we're doing. So they're going to start by just taking referrals from the health systems here in Northeast Florida, but we are going to be moving to allowing this to be done on even an individual basis, coming in and making appointments. And we think that that's something that's very important. Clearly, this has now been employed on an emergency use basis since the end of last year. So we have a lot of time to have watched what's happened, and there's clear benefits to this early treatment for keeping people out of the hospital and reducing mortality. And this is also true whether you're vaccinated or not. I mean, obviously, if you're vaccinated, we think the data in the hospital shows that your chance of being admitted and having a severe illness is less than if you weren't. But at the same time, we are seeing people testing positive in higher numbers than I think most people anticipated, and that's just not in Florida. That's really in places like Israel and other places around the world. So if you're vaccinated or unvaccinated, if you're in those high-risk groups, you can still do the monoclonal antibody. The only issue I think that doctors would tell you is if you're not vaccinated, high risk, you come in, you get infected, come in and get it, absolutely. You get the treatment. You have to ask the physician at what point in the future, if you do want to get vaccinated, do you have to wait because there's antibodies and they want that to be able to clear. But that's really, at the end of the day, the only major thing that you need to look at. So who are the high-risk groups that would most benefit from this? Obviously, elderly populations, people with chronic kidney disease, diabetes, morbid obesity, cardiovascular, chronic lung disease, people with sickle cell. Those are the folks that, if infected with COVID-19, may end up seeing significant consequences and could result, of course, in a hospital admission or worse. So if you do it early, this has a great chance to resolve those symptoms short of you needing medical attention. And that's really, at the end of the day, what it's all about. So we want to be able to do all we can to be able to do. Now, what we're going to do is, so we have this here. This is helping relieve some of the pressure, because I know they're doing a lot in these health systems. So this is supplementing that, and we'll expand as needed. And really, it's just a matter of, you can do it through IV or you could do it subcutaneously. If you do it subcutaneously, it's easier to do, so you can probably get more people through if you have the appropriate setup. So we're going to be expanding as much as we can, and we may use other footprints in Jacksonville. And then we're also looking beyond and throughout the state of Florida. There's websites. HHS has a website, for example, about where you can get monoclonals. The problem is, if you go on it, some of these places, some of them have it, but they just aren't administering it. And others don't necessarily have it. So what we're looking at is, are there gaps in certain parts of Florida where we can bring some of these mobile units and then be able to offer this to folks who get infected in early treatment. And I think this is going to be something that has just got to become part of the standard of care as you go forward. This is going to be with us for a long time. I mean, I hear these politicians say they're going to conquer it and end it. It's not going to be eradicated, as we've seen. It has different iterations. The vaccines obviously are helping people avoid severe outcomes, but you're going to continue to have this, go in the different patterns. So understand, if you're in those risk groups, that this is really something that you need to be thinking about if you end up with a positive test. So we're going to be doing that. We're also going to be doing strike teams to be able to bring it into nursing homes if you have some nursing home infections. And we've seen that. Nursing home residents were some of the first people to be vaccinated, and I think you saw a huge decline in cases in nursing home residents, but you are seeing more of that now in different places. And so if you do have somebody test positive, obviously you can help that resident. You can also use it as prophylaxis. So if there's 6 other nursing home residents, maybe none of them have tested positive yet, you can go in and offer the Regeneron to them, and that's proven to help them avoid infection entirely if you're able to get it early enough. And so we'll be using it for that as well. So really focusing on providing early treatment for the most vulnerable, to keep them out of the hospital, and ultimately to save lives is what we're going to do. Remember, the sooner you do this, the greater the chances of success that you have. There have been a lot of people that have been helped by this, but I really believe that had more people known about this I think absolutely some of those folks would not have ended up needing to get admitted to the hospital. So I want everybody to know that this is an important option, that this is an important way to be able to protect yourself in the event that you are infected. And we're going to be doing this in other parts of the state, and obviously working with our long-term care residents who we've been working with from the beginning to make sure that they're provided the type of protection that we can. So I want to thank Mayor Curry for working with us over these many weeks, and also want to thank Kevin Guthrie, Division of Emergency Management. He's been working with all the different systems about different stuff that they needed. So we're going to hear from some of them, and we look forward to being able to kick this thing off here at 12 o'clock. So, Mayor.
Thank you, Governor. I just want to say, over the last year and a half, we're grateful from when the virus was first with us, and we had to rapidly expand testing. We didn't know what we were getting into, but we knew we needed it. You got it here. Jacksonville had tons of access to testing. Then when we got into the new year and the vaccines were rolling out, again, working with you and your team, our vaccines have been and are readily accessible to our residents. And now this antibody treatment, as the governor said, is not well known by the community. It's effective, it works. I was on a call yesterday with all of the hospital CEOs in town, and we had this discussion. People need to know this exists. They need to know that this unit is here. If they don't have access to their health care provider, Governor, thank you.
Yep, absolutely.
Hey, good morning, everyone. I just want to again thank the governor for his leadership on this breakthrough treatment, and I want to make sure that everybody knows that this is a quintessential example of where local and state government work together very quickly to get something done. So again, thank the City of Jacksonville, the Jacksonville Fire Rescue Department, the Jacksonville Fire Rescue Department's emergency management team, the Jacksonville Sheriff's Office Emergency Response Unit for getting all this set up overnight, and of course our vendors. So again, Governor, thank you very much for your leadership on that.
Okay. Ken?
Thank you, Governor.
You should tell them a little bit about yourselves today.
Sure. Hello, everyone. I'm Dr. Ken Shepke. I'm the Chief Medical Officer for the Florida Division of Emergency Management. I'm board certified in emergency medicine and EMS. And so I want to thank the governor for highlighting this very important therapeutic advancement. Unfortunately, I don't think the word has quite been out there enough for this very effective treatment. It's great for folks who are vaccinated but at high risk for progression of disease. It's great for folks that are unvaccinated who get this disease. And it's great for folks who they're unvaccinated, they're not ill, but they've come in contact with a household contact of somebody who's gotten COVID. So as the governor reported, folks who are at high risk for progression to severe disease or death from COVID-19, this therapy can reduce your risk of hospitalization and death by 70%. And that unvaccinated household contacts of those folks can reduce their risk of developing COVID-19 by over 80%. So this is clearly one of the better therapeutics that we have out there, and I'm really appreciative to you, Governor, for getting the word out there, because I think it's going to be very helpful for the state of Florida. Thank you.
Great. And if you so the data, as Ken said, the data is very strong. We have now a long runway where we've been able to do this. And that obviously, the data trumps, but it's interesting just when you talk to people that have done this, and there have been people that will get infected, they get hit, they test positive, they go get it, and then they'll say within 24 or 48 hours, they felt it was like a totally different ball game. And what it is when you get infected, your body produces antibodies to then fight the virus, and people who end up having an easy time with COVID usually do that fine, and they're great. Folks who are in these higher risk categories, they sometimes don't produce the type of antibodies that they need to be able to combat the virus. And so what this does is it's an antibody cocktail. It's providing that, and then those antibodies get to work and really fight against the virus. And I think that's why you've seen people will say that everything is resolved within sometimes 24, 48 hours. That's a really, really big deal. And I think that part of the reason it isn't as well known is because this was given emergency use authorization about the same time that the Pfizer and the Moderna were under EUA approved. So obviously people were looking at the vaccines as a major thing, and rightfully so. And so I think that this was something that, even though the hospitals all embraced it, we worked with them early on and said, do you need us to do anything? They're like, no, we have it. And most of them have been doing well. Here in Northeast Florida, I was at Tampa General. They do a lot. We think the supplementing them now will be helpful. But it was there. but I think it was not something that was really publicized. And I don't know, I mean, maybe people thought that if you tell them there's a treatment, then they wouldn't necessarily get vaccinated. I don't think it's an either or. I think we know in a situation, we have people in society that are not vaccinated. We also have people that are vaccinated who are still testing positive. And so either way, if you get in that situation, particularly in these high-risk categories, this should be your stop. This is what you should be asking your doctor about, and do this. We will probably, the Surgeon General is probably going to do a standing order, which will make our sites available to people if they meet the certain criteria. So they won't even necessarily need a prescription from a doctor because we'll have the standing order. So hopefully that'll make it easier for people, and it'll increase access for folks going forward. So this is just one thing we're doing. We're going to be doing more. But I do think that this is probably the best thing that we can do to reduce the number of people that require hospitalization. With that, I can take some questions. Yes, ma'am. So just so if I can clarify, I was asked about respirators, which are actually different. And so and we've never really had any hospitals ask about it. What they had been asking about, which I thought related to respirators, was there was oxygen deliveries on these trucks that they thought were coming behind. So there was actually things to do the weights and measures and all that. So there was not, to this day, any requests for respirators. The mechanical ventilators, we've been giving those out the whole time. And what that was it's just increasing our stockpile. And that's why they did it. So it wasn't anything that was like specifically from a hospital per se. It was something that they do through FEMA as a matter of course. Well, I think the staffing has been really the biggest issue that we've dealt with throughout the whole pandemic. I mean, if you recall, you saw really significant changes in how some of this is done. You've seen a lot of people go to contract. So they literally could have a job at a hospital, change jobs, work for a contracting agency, and then still do the same job at the hospital. They make a lot more money, and it's a lot more expensive to do. So there's definitely a war to try to get staff. I think it's been something that's been difficult. We have provided a lot of staff in the past for that. But our sense is that they deal with some of these agencies to try to bring people more in. That's just the situation that you're seeing all throughout the country. But there's no doubt it's not really a capacity issue as much as it is the stress on the staff, when you have higher volumes of patients. Yes, sir.
On the monoclonal antibodies, I believe President Trump used Regeneron when he had
Yep.
it last year. I talked to a lot of patients who say, look, I'm interested, but I have no idea how to get it. Has this been something just for exclusive people? And why has it taken this long to get it to a point where the average citizen can maybe even start to get
So the answer is when President Trump did it, it was still an experimental, so it had not been emergency use. So the average person on the street in October of 2020 would not have been able to access it unless they were part of some type of trial or had different access. Once it got the emergency use authorization, it has been widely available. And so that's been done mostly through hospitals, now increasingly through doctors' offices. And I think part of the issue is have been a lot of physicians, I think Ken would agree, there's a lot of physicians that didn't necessarily know about it, and some of the physicians weren't. More and more physicians are understanding it now, and it was just a type of thing where I do think there was maybe people thought if you stress early treatment, then you were telling people that to not get back. That's not an either or. Now it's pretty clear, though, that there was not as much knowledge. So I think it's less about access, but just about knowledge, because if somebody gets infected, what they're thinking is, okay, I don't necessarily feel that bad. I know I'm at risk, but I'll just kind of ride it out. And that's what you normally would do on most illness. I totally get you. If you don't expect to go to the hospital until you start to feel really ill. But on this, if you have those risks, if you can do it early, it really makes a difference. And so the access is there. We're able to do. We can place orders for 10,000 treatments at a time, and so we're going to have. Obviously, you have staffing and stuff that you have to make sure. They're going to work here to try to make as many people go through here as possible, which will be really, really good. And the same thing as we go throughout the rest of the state. So access in terms of anybody, particularly if you're in those high-risk categories, you absolutely are eligible for it. It's just a matter of making sure that your health systems are offering it. Some clinics are doing it. And then we're now looking at saying, okay, we have some freestanding stuff that's already been going on where people have come in to get vaccinated, to get tested, whatever. Maybe we do a monoclonal and set it up in conjunction with some of those other things. So I think you're going to start to see that. But since the EUA happened, it has been available for everyone. I think initially they had it with a more limited age range, and then they've since dropped the age and so made it available to a wider group of people. But those really high-risk people, the elderly and some of those serious conditions, they have been available to them since the beginning. Yes, ma'am. Such as? Well, so I think the non-pharmaceutical interventions we've seen, remember, we were promised that they would end the pandemic, lockdowns, school closures, mandates, and it just hasn't done that. This is a very transmissible virus. The last iteration last summer, someone got infected, they'd likely infect one or two other people. This one, they're infecting more than that. It's airborne, it's aerosolized, and so we just have to understand that when that's happening, these waves are something that you have to deal with early treatment. Because we could sit there and say, if we shut down schools, it would go away. It won't. That's not true. It would be very damaging to society to do that and to our communities. And so early treatment, I think, is probably the most effective thing you can do. Obviously, if you're higher risk and you want to avoid certain situations, you want to take personal mitigations, by all means do that. But just understand with how contagious this is, and we're seeing these waves in other parts of the world, and you will see them in other parts of the United States as the season changes. The fact of the matter is there's going to be a baseline level of exposure to folks in the community. And so let's just make sure this is out there. Let's make sure people have opportunities to be able to do it. I can tell you it will absolutely make a difference in reducing the number of people going to hospital. But it doesn't mean you don't do some of the other stuff. I mean, I think if you're vaccinated or unvaccinated, you still do this if you're high risk and you get infected. But of course, the hospital census, and you look, I mean, that's pretty strong data that we're seeing across Florida of the folks who tend to be admitted to hospitals now, and how that's different from last summer, when we didn't have the widespread vaccination of our elderly population. Yes, sir. Well, they might, yeah. So I think the latter part's a good point. I mean, as we've seen, we've had a wave of infection, but it has not been uniform in terms of when it really started. It started in Northeast Florida before other parts of Florida. We think the indicators with the 7-day moving average, as I mentioned the other day, that's down for cases. RT value actually today, according to the Stanford and Yale models, down to 0.81, which is definitely the right direction, as well as the ED visits for CLI, which is trended down as well. So those are good indicators. And then some of the other parts of the state, I think the growth has slowed, but they may not have necessarily gotten past that. So we'll look at that. I think it is a huge state, and I think that these waves are not necessarily uniform in terms of how they do. But I would just point out, I mean, with like these daily cases, those are reported publicly, every day to the CDC, so people have access to that. But in terms of the breaking it down by county, that may not be a bad idea going forward. I know we used to look at that a lot. Clearly, you can follow where the hospital admissions, have been. And if you look back to last summer's wave and compare different parts of the state, here is where in Northeast Florida, they've had the biggest increases over and above last summer, compared to, say, Miami-Dade, which hasn't necessarily reached their hospital admission level that they had last summer. So those are important things to know. And obviously the community, people should just be aware when you have higher prevalence, whatever types of personal mitigations you want to take, you obviously will be able to do it. So we're going to look forward to having people come in today starting at noon. This is just the beginning. We're going to be expanding this more. And as we go forward, we're going to see the current wave, is going to go. We're going to see that in the different parts of the Sun Belt, including Florida. But it's not going to go. COVID's not going to go away. We're going to have future, I think, trends. That's just natural. So the question is how are we going to approach it? You can approach it on the front end by protecting yourself. But of course, if you end up in a situation where you are infected and high risk, getting in here early, this is the best shot we've got right now to keep people out of the hospital and keep them safe. So thanks, everybody. Appreciate it.